So I presented on some work that we've been doing over the past 4 years to look at whether or not primary healthcare indicators have equity or measuring health equity. And so this is important because we need to know what's counted. So if you have cervical cancer screening rates, that seems like a fine indicator, and there's lots of evidence as to why you would want to measure cervical cancer screening rates, because if you have higher rates, you hopefully will have lower cervical cancer and hopefully lower deaths from cervical cancer. So you want to be screening. But if you're a woman, for instance, and there's a lack of stable housing, you experience structural violence or domestic violence, you have mental health issues or substance use issues, then what happens is cervical cancer screening may not be the top of your priority list. And so providers need to do a lot more work in order to get the person to a place where they can get the cervical cancer screening rate. And there's lots of things that aren't counted, because the only thing that's counted at the end of the day is the cervical cancer screening rate. So a solution is to incorporate these kinds of indicators into what we're doing in terms of performance measurement in primary healthcare across Canada. So organizations that deliver primary healthcare services can learn from organizations that primarily target populations who are made vulnerable by different social determinants of health in terms of their equity orientation.